Are there areas on the face that you suggest people absolutely do not have filler?
Absolutely. Do not have filler. I'm talking about the hyaluronic acid fillers in the tear trough area. What has been seen, and I've never put any fillers there. I've always thought it just something just told me it wasn't a good idea. And so I've never used any there. And what we're seeing is that as the fillers go away, the results you see in 18 months or whatever is gone, but some of that filler is there. And for some unknown reason, it becomes hydrophilic and it starts retaining fluid, and people are forming these bubbles under their eyes. And we don't know why, but it's associated with the HA fillers. Now, I think it's safe to use it in other places, but what I'm doing, I still like the HA fillers for the lips. I mean, it just, you can really contour it. It's nice. But now, instead of using the hyaluronic acid, I like the fat, and there's something new. It's called, it's PRP, except it's dermal PRP. And we draw the blood, just like, you go and have a blood test done. We take a vial, we centrifuge it, and we take some of the platelet poor plasma and separate it from the platelet rich plasma. The platelet poor plasma is just platelets that is still bound by protein. And we heat it to 100 degrees centigrade and for 8 to 10 minutes. Then we put it in a cooling bath and it forms a gel. And you take that gel and you augment just like you would with a filler, except it's your platelets. Now, platelets are like stem cells. They have all these growth factors in them. And so it's going to stimulate your collagen, fibrin, and elastin to make tissue. You put it in, and also this technology that this company has come up with is they have found a way to take a silicone plug and put it into the test tube, and when you spin it, it rises and it keeps all the granulocytes, the red blood cells and everything, away from the serum. And whereas regular platelet-rich plasma spun down will have 1 million to 1.5 million platelets per microliter, this has like 5 million, 10 million. It's just off the chart. And so you're taking it that you've denatured the protein and made a gel out of it. You're using it as a filler, but it has all these platelets in it, and it stimulates your body to replace your collagen. And so you do that, and then maybe 2 months later, you may have to use half as much and touch some areas up. Then beyond, it's so new. I don't know what the long term is going to be. Whether you have to do it once every 5 years, twice a year, once every 3. No one knows long term. But I've been using that, and the results have been just over the top. And so I'm giving the patient their body tissue back with the platelets, and it's generating all of this. And that's the new. You probably have not heard a lot about it. It is really, really new, and it's through this company that I'm doing the hair research for. So we kind of got in on the leading edge of that technology. But you'll hear more about it. It's called Dermal PRP.
Well, there's